Welcome to the Spectrum of Health podcast. I'm your host, Dr. Christine Schaffner, and today my guest is Dr. Darren Schmidt. We're going to be talking about a new test that measures physiology, the effectiveness of your clinical protocol, and predictive of longevity. So it's super exciting. I can't wait for you to hear this conversation with Dr. Darren Schmidt. Welcome to the Spectrum of Health podcast. I'm your host, Dr. Christine Schaffner, and today I'm here with a dear colleague, Dr. Darren Schmidt, and we're going to be talking all about new blood test measures and guidelines that track the most important 6 factors of your health. So, welcome, Darren. I'm so excited to interview you today.
Well, thank you for having me. I really appreciate it.
Well, I've always loved your work. I think we both make the cell core circuit often. We find each other speaking at the same time, or I'm learning from you in the audience. And after your talk this year, I found you in the exhibit hall and I said, I have to interview you. I want to learn more, especially about the work you introduced. So I want the audience to get to know you and, learn these new tests and really how we can really make an impact for people, right? There's so much confusion on lab tests, and if we can really distill it to these 6, tests, it's just a whole new world, isn't it?
Right.
Yeah.
Exactly. Yeah.
Yeah. Well, we were talking a little bit about each other's backgrounds before we got on, but I'd love for the audience to get to know you and how long have you been practicing? What's your, background? You're a chiropractor and anything you want to say about the kind of foundations of your practice.
Okay. So I started practicing in 1997. I started nutrition in 1998. And then I've really had a big focus on diet and then supplements. And then Cellcore came out in 2016, 2017. And that kind of like changed everything because their products are so effective at getting parasites out and toxins. And then Todd Watts, one of the founders, I mean, he's the main supplement developer. He's got his 5-step roadmap to health. And I've seen a lot of philosophies and theories and, ways of thinking in improving somebody's health and reversing chronic illness. And his made the most sense. I mean, and the crux of it is that there's a hyper focus on parasites because they harbor all the bad stuff like Lyme and bacteria and metals, etc. Then when they're out, then you're free to start detoxing and free to go after Lyme. And so I took those 5 steps and I kind of expanded them to include diet and then an optimization step and stuff like that. So that's my main background is, well, I mean, one thing I need to say is that I haven't taken insurance in 20 years. So therefore I have to get people better. And if I don't get people better, why would they come and see me? So
Mhm.
I did that for the main reason is that it would force me to become a better and better clinician.
Mhm.
So I always like to study anyways. And so here we are with this new exciting blood test that kind of validates all the work.
Yeah. Yeah. I don't take insurance either. Yeah, you have this sense in this application always, right? You'd hope as a doctor, but it is up to us to stay current and continue to evolve our medicine. I'm always saying like we need to find the most elegant path because I know during our careers, there's been so much information now that's out there. I know it was hardly available on the main stage until now, but it's still there's a lot of confusion in people. There's a lot of ways to think about things. And I know that you have your roadmap to guide people, but we really need to continue to evolve this medicine. I feel that we still have a layer to continue to evolve, especially where we are in practice now.
Yeah, that's right.
Which brings us to the MVX, right?
Right.
One of the things that you talked about B1, which I use in practice and I'd love to pick your brain about, but you really introduced this index of 6 factors that really are predictive of longevity. And so why don't you share with the audience, like, how did you even come across this and how did you find this test to bring into your practice?
Okay. So the test is called MVX plus. It's MVX stands for Metabolic Vulnerability Index. I found it a year ago, so May of 2024, and it was a introductory video on YouTube, and the speaker was Dr. Bill Cromwell, one of the developers. And I watched that video, and I was like, "Wait a minute, what is he talking about?" I watched it like 10 times now, and he describes the 6 factors, and you put them together. You have to test them through NMR, not the regular other assays, but NMR machine. And they give you a score 1 to 100, and you want your score to be low. And they've run this on 30,000 people through the NIH, and they track people, when they pass away, they look at their um, MVX score, and they look at, where their 6 factors are within the MVX score. And then they graphed out what if your score is 50, or let's say if your score is 55, you have a 20% chance of dying in the next 5 years. So then what do you do? Well, it's made out of these 6 factors. So you just improve these 6 factors. And it just turns out that in my career, the 7 steps that I came up with Todd Watts' help, it exactly matches the 6 factors of MVX. And there's no drugs, there's no miracle pill, miracle chemical. You have to work at it. And it's basically comes down to detoxing your body, cleaning it out,
Hmm.
and then nourish it.
Hmm.
So that's MVX. And so it gives you scores too with the 6 factors. And the optimal ranges are different than what the reference range is on the lab.
Hmm.
So I got it released in January 6th of 2025. So when
Hmm.
I saw this video, I was like, I need to test this on myself and my patients. So I called up the NIH, the people that were running it, and they refused to turn it on and let it be active for the public and they said the most ridiculous reasons. They said they're waiting for consensus. And they also said it doesn't measure disease. Like these are two problems, right? And I was like, well, I understand it doesn't measure disease. It measures physiology.
Right.
And then I contacted another lab and they said they won't turn it on because they didn't want to look like voodoo doctors. And then I called NASA and I called LabCorp and 5 other labs and nobody would turn it on. Finally, I just by luck, I got a hold of somebody at Professional Co-op Services, and I had a question, and he answered the question, and I said to him, I'm just really excited about MVX, and he goes, well, we have that. I was like, well, I know, which I didn't know, but
Yeah.
I said, I know you've run it on 30,000 people, but I can't get it for myself. He goes, give me 15 minutes, I'll turn it on, just
Wow.
like that, and so that was January 6th. So,
Wow.
and
Wow.
as a matter of fact, I met him today on Zoom for the first time. His
No
name is
way.
Yeah, his name is Dave at Professional Co-op.
Yeah.
So, yeah,
Impact. Yeah. Like that was like divinely guided, right? And so,
yeah, I think
um,
so.
yeah, I want to go through what the test is and what we can measure before we kind of hear, how these 6 months more or less have gone with having access to this test. So it's a metabolic test, and it's a paradigm shift, right? It's not a single mechanism, then finding a drug and then treating a disease. This is like truly prevention because we're looking at physiology, and you and I are very astute to see physiology changing within our patients. And we trust that, process. And it's more than one variable always, for our patients. And so, what are we testing in these 6 factors? I have it here in front of me. So, why don't we go through it?
Yeah. So the first one being GlycA, and that's a combination of several factors measuring infection and inflammation. And it correlates with all the other inflammatory markers that we know about. So interleukin 6 and TNF alpha, C-reactive protein, homocysteine, et cetera. So it's a really good marker. And so when somebody has a high GlycA factor, then you have to find out why and test for organisms and test for inflammation and address it. And address it like long term, not just giving antibiotics, but fix the body, fix the immune system, detox, whatever it takes to bring the
Yeah.
GlycA down.
Yeah. So we have GlycA, and then I believe small HDL particle number is next.
Right. So this is a lipoprotein measurement. So when you go to the cardiologist and they measure LDL and HDL, that's not the same thing. This is the number of small HDL particles. So it's like this. So HDL can be small or medium or large. You want the small ones to be in a high amount, like a great number of small HDL particles. And if it's low, that's a toxicity issue. So
Yeah.
you need a detox. And I figured this out. At first I thought it was a diet issue. And I've
Mhm.
been on the carnivore diet for years. I got a patient who's a vegan for years, and we both had a low small HDL particle count. And mine was due to a gas leak at my house. And he just has an accumulation of toxins, and he's doing much better detoxing. And I have to do his second, MVX. But I'm just saying, like, at first I thought it was a diet issue, but it's not. It's more of a toxicity issue.
Yeah, when I was, looking at the other, markers, like looking at lipid protein, profiles, when HDL, we're always like, "Oh, that's a good cholesterol," and if it goes up in that total number, we've always thought of pesticide toxicity. I found a paper, that showed, um, pesticide toxicity related to HDL, so I know it's the inverse with what we're talking about, having a high amount of small particles, but yeah, I see that with lipids, and I think there's so much misunderstanding about lipids in our society, and
Yes.
also with the LDL, a lot of my patients on a regular cholesterol panel, and then I'll fractionate them with NMR profiles. The LDLs are often high, and I find that can be related to toxicity as well because of the
Yes.
liver and the thyroid. And I'd love your opinion on anything else cholesterol related, just to educate people who are still confused out there.
Right. And one of the speakers this past weekend at the Cell Core Symposium talked about that the lipopolysaccharides being high
Yeah.
from gram negative bacteria. And that's very poisonous, LPS, very poisonous. And it's carried by the LDL. So your
Yes.
body might make more LDL in order to carry away the toxins
Yeah.
of the gram negative bacteria. And I have a list. I don't have it handy, but I listed out all the reasons why LDL goes up. I mean, ketosis is one reason, fasting is another, endurance exercise, toxicity, infection. So LDL is not the cause of heart disease, despite what all the cardiologists say. It'll bounce up and down depending on, and some people have genetics, so it'll go up when they eat meat, it'll go down when they eat white bread and candy and cookies. So it doesn't mean that candy and cookies are good for you because your LDL goes down on it. It's
Yeah.
just the genetics. So the whole MVX viewpoint and the small HL particle lipoprotein breakdown. That's the shift that all cardiology needs to go to have a better understanding what's going on in their patients' bodies. Yeah.
Yeah, that's such a good point. Thank you. And then there is this metabolic malnutrition index. What is that?
Yeah. So the first two things we talked about, GlycA and small HL particles, that's the inflammation vulnerability index. Okay.
Mhm.
So this is one of the two indices within the whole metabolic vulnerability index. Okay. So now what you just asked about was the metabolic malnutrition index. So that's about malnourishment. And then there's four factors under that are, and there's a bunch of math. They get numbers and they do math and then they give you a number for all three indices.
Mhm.
The MMX, metabolic malnutrition index, is the third index.
Okay. And that would be like lack of nutrition status, or malnourishment.
Exactly. Yeah. Quite specifically, B1 and amino acids, the branch chain amino acids.
Mhm.
And that can indicate malabsorption, digestive issues. And of course, B1 is endemic. A lot of people have B1 deficiency. So, yeah, that's all exciting. It's an
Yeah.
exciting topic for me. Yeah. It's exciting because in our field, we're in nutrition. What test is there for malnutrition, right? Like there hasn't really been one. And now we have it.
Yeah.
And it's a new concept in my field, in my practice. It's like I've told people in the last couple of months, "Hey, you're malnourished. What are you eating? How's your digestion? Does your stomach hurt?" That kind of stuff.
Mhm.
Yeah.
Mhm. I think one of the speakers said, I think Jabin said it's like 5 apples to 1 apple equivalent of nutritional density nowadays. So you have
Yeah,
to eat.
compared to the past.
Yeah, you have to just eat really good quality food or, augment your nutrition. And then there is a marker of mitochondrial function, right, with citrate.
Yeah.
Tell me about citrate.
So citrate is one of the six factors, and it is the first large molecule within the Krebs cycle, the beginning of the mitochondrial production of ATP, and hence the name citric acid cycle. It's other those, that's the Krebs cycle. And so when you have too much citrate in your blood, it means that the citrate's not getting into the cells and into the mitochondria. Now, I on ChatGPT, which was wrong, it
Yeah.
said that it's a toxicity issue, but it's not. It's actually a malnutrition issue. And so there's supplements that have all the nutrients for the mitochondria and more, right? So there's a Facebook group called Understanding Mitochondrial Nutrition,
Oh, cool.
and they talk about the 22 nutrients that the mitochondria need to function. So for me to lower citrate, I just give that product, the new product from Cellcore, it's called Core Nutrients.
Great.
And then B1, yeah, like those two things together right now, that's my best solution for that. It's really simple. Yeah, to lower the citrate to normal.
Is there a type of B1 you gravitate for the citrate issue?
No, not really. I
Okay.
mean, it just more depends on their symptoms. Like if they have neurological things, then it's TTFD for the brain. Body symptoms are the benfotiamine, and then the regular B1 salt. That's I use that for maintenance, more for maintenance.
Mhm. Got it. And then I kind of, from my very cursory understanding, I was grouping these amino acids, valine, leucine, and isoleucine together with kind of what their purposes are in the test. So maybe elucidate on that for us.
Yeah. So this is really interesting. So those amino acids are called branched chain amino acids,
Mhm,
and they come as a group. And on the reference range on the test, they should be high normal.
mhm.
So if they're too high, it means that the person's not digesting their food very well. And the best solution for that is actually B1, right? And then they might need some stomach support, gallbladder flushing.
Mhm,
Maybe they have SIBO, that kind of stuff. So fix their digestion. And then if their amino acids are too low, it's the same thing. It's a B1 deficiency. So B1 fixes a lot of factors. It fixes citrate and the three amino acids. So that's why I've been saying for at least 8 months that B1 is the most important nutrient for human beings.
Yeah.
Yeah.
Wow.
So here's the connection though with B1. I'm sorry, with these amino acids and chronic disease. So when they're too high in the blood, it prevents the liver from cleaning fat out of itself. So now you have a fatty liver. You end up with all the metabolic syndrome conditions. You get high blood pressure, insulin resistance, high blood glucose, type 2 diabetes, high hip, waist to hip ratio, BMI high. It's a lot from a B1 deficiency. And then therefore it'll bring down the amino acids, and then your liver can now defat itself. I'm still a fan of the ketogenic diet because that can defat the liver. Of course, detoxing can defat the liver. So,
Mhm.
it's a holistic viewpoint for sure. And
Right.
that's the great thing about this test is like it's only 6 factors, but from that you can go down this avenue or down the other avenue, whatever that person needs, to fix that number or to fix the collection of numbers. Yeah.
And then all of these numbers that we just shared up kind of like they're tied up together to create a score. And that score is a 1 to 100, correct? And you don't wanna
Right.
be on the 100 side, you wanna be towards the under 50 side, it sounds like.
Right. So the overall MVX score, ideally you'd be in the fees. The lowest score I've seen is 13.
Wow,
A retired Navy fighter pilot. Yeah.
no way. With all that exposure too, that's fascinating.
Yeah, and I think there's genetics there because I've seen, if maybe it was his brother or his dad or somebody, they also had a really good score. So, so if somebody has a score of 50 or 40, you
Mhm.
know, bring it down, right? Even if it's 32, which is really, really good, why not get better? Bring it down to 30, 25, 20. I've seen it. I just had a patient, she lowered her score 14 points in 10 days,
No
right?
way. Wow,
Yeah.
wow.
And yeah, and then so let me share this too. So I just had a patient, this is 2 days ago, on his re-exam with the MVX, his score went up 9 points, which
Mhm.
is the wrong way to go. And
Yeah,
so like it puts me as a practitioner into the situation like I better get my act together, right? And figure out like what am I missing with him? And I
right.
think I figured it out. I'm gonna send him a message tomorrow to change up his supplements, but it puts the patient and the practitioner, in the same like arena of like, the same goal, I should say, get that number down.
Yeah, yeah. Did you have a, like, aha moment about an exposure or just not the right supplements he's on or, like, how did
Yeah. It's
yeah,
not for him, it's not the right supplement. I found a more whole food based supplement that should work better.
yeah, got it.
Yeah.
And then for it sounds like, B1 is critical, and then, you mentioned already, like, the forms of B1, and are there, like, let's say, like, you know, I take the test, I have a score of, like, 40, and my amino acids are all, high. Would you put me on benfotiamine?
Yep. Put you on benfotiamine. Yeah.
And then how much would you put me on? 250 is, like, usually, like, the Benfo Max or, they're I think they're in 250 milligrams they come in?
Yeah, so it could be, I mean, typically more than 500 milligrams. I would say 500 to 750 milligrams of
Okay.
benfotiamine. And the other thing about that is typically people are done with it in 6 months. So you don't take benfo forever. If you want
Yeah,
to do, if you want to do B1 forever, then do the B1 salt.
the thiamine hydrochloride, yeah.
Yeah,
And
exactly.
then, citrate, B1, everything B1, it sounds like. Everything in the MVX could be benefited from B.
Well, definitely the MMX, the
Yeah,
metabolic malnutrition index. So
yeah,
I don't, so it's like it's only been out for 4 months. So theoretically, somebody could go on B1 and their whole score goes up and everything gets better. I'm
yeah,
sorry, their whole score goes down
yeah,
and everything gets better because
yeah,
B1 fixes the mitochondria, which is what we're all about. When the mitochondria work well, you're detoxing, your immune system is strong, and you're digesting well. And so, I can see how there can be some home runs with just B1. And then
yeah,
other people, they're gonna more of an adventure, let's say, with more supplements, more detoxing, more immune system work. Yeah.
What was your highest score you saw so far?
78. And she has metastatic breast cancer to the spine, and it's not good.
Oh, yeah,
Yeah.
yeah, yeah. It could be, I'm sure, like, in the cancer context, right, it can monitor, like, uh progression of cancer potentially or
Yeah. Yeah. And then in my top 5 worst scores, one of them is rheumatoid arthritis, very severe.
yeah,
Another one is athlete who works out every day, multiple times a week, runs multiple times a week, weight lifts, but she eats sugar. And yep. And so when I called her up to send her the results, because I don't have her email address, I said, "Hey, I need your email address. I got this MVX test." And she goes, "Is it terrible?" I said, "As a matter of fact, it is." She goes, "Yeah." She goes, her score is 69.
wow.
She goes, "I've been in the hospital for 3 days. I got blood clots in my arms, my chest." She's got one under her jaw all the way to her armpit.
No.
And I've been seeing her for 10 years. Every time I see her, I'm like, "How's your diet?" She doesn't want to talk about it because she eats sugar.
Yeah,
So on the phone, I was like, "Okay, you're off sugar now, right? Forever, for the rest of your life, no more sugar." She's like, "Yep." Yeah. So the high score, if you have, let's say, 20 people with a score of 50, you can have all kinds of different diagnoses. It doesn't matter what the diagnosis is, cancer, heart,
uh,
autoimmune, or just fatigue or depressed or whatever. The
long
symptoms,
COVID, yeah,
long COVID, yeah, the symptoms are what they are. And then
mhm,
the diagnosis is a collection of the symptoms. But when you
mhm,
get to the physiology, you look at, how's their inflammation, infection, malnutrition, toxicity, digestion. Like that's where it's at. You're just healing the body, right?
yeah,
Regardless of whatever the disease is.
yeah, yeah.
Yeah.
What's the earliest you would retest somebody?
Earliest, well, this one woman, she did it in 10 days because
Yeah,
she was excited to get it done again. So
yeah,
typically it's every 4 weeks at the
or
beginning when somebody's on a program. Yeah.
yeah. So it's quicker than, like, a hemoglobin A1C, right, which is 3 months, yeah,
Yeah. And it's very inexpensive.
yeah, which is great. I mean, there's a trend, I mean, there's been a trend for a long time about longevity and prevention and screening and now there's like the whole body MRI score, technology and all these different direct to consumer screenings, but this seems like a very It feels very elegant, and it's very simple, but it actually, um, highlights a lot of the ways humans function or malfunction, you know?
Yeah,
Yeah.
definitely. Yeah.
Yeah. And then what's your score now? What are you hanging around
My
at?
score is 29. It was 55 in January because I had a gas leak at my house,
Mhm.
and then it dropped 4 weeks later to and then it went up to 39 because I had a sinus infection, and then 4 weeks ago, it was 29. So my next blood draw is in, 3 days for my yeah,
Yeah. Keeps you honest, right? It's
totally. Yeah, it's the proof. Yeah, and I had a patient, relatively new patient, I was talking to him this past week, and, he's kind of, like, nonchalant about his health. I think his wife dragged him in, and he had a stroke, like, 5 years ago, and I said, "Yeah, like, this MVX score needs to be retested to make sure that you're honest and I'm honest," because he was eating tacos and bread and stuff,
Yeah.
and he got it. He understood it. He's like, "Yeah, it's a good idea, like, retest to make sure I'm getting better." He's like, "I like that idea." So he suddenly became from nonchalant to
Yeah.
serious about it, you know? Yeah.
Yeah. Especially like in this, industry where there's a lot still, a lot of different ways people can go with medicine to make people, kind of change and reverse illness. And so this is a good litmus test. And, I think we have a lot of markers that help keep us, knowing we're on the right track, but there's sometimes a little bit you have to look at the pattern or kind of like the interpretation. And yeah, there's like, this is kind of black. This first thing I've seen is like black or white, in medicine that we can really hold our or hang our hat on rather. So I'm excited. I'm excited to use this. And I think it's, definitely something I want to learn more about. Do you have any like critics, people saying, oh, that's not the right, that there's loopholes in this, or, I have a good score, but I have these horrible tests here, or do people kind of have you seen any of that yet in just the construction of the test and people evaluating it?
I have not.
Yeah, that's good.
No. Yeah,
Good.
I mean, it could be that nobody's looked into it deep enough. Like, I'm sure I'm the one that has looked at it more than anybody else, and I know more about it than the people that developed the test. And
I love it.
I've talked to 2 of them, and I told them some things that they had no clue about.
Oh, that's
So,
so
yeah.
cool.
Yeah.
And they probably did they get their test done because it wasn't available, right? Or maybe they got it in the research they were doing.
I don't know if they did their test or not. They did do a series of 2 tests at Duke University, one on statin drugs, which did not lower MVX,
Yeah.
right?
Surprise.
And
Yeah.
another test on exercise for 8 months. They had a control group, light exercise, moderate, and heavy exercise, and it did not lower MVX. And
Good.
right, and I told this researcher when she told me that on the phone, I was like, "Yeah, it totally makes sense because exercise is not part of my 7-step blueprint that I created in 2018. Neither are statin drugs. There's no drugs on my 7-step blueprint, and there's no exercise either. It doesn't go deep enough. You have to fix the physiology by detoxing. So
Yeah.
exercise is not deep enough."
Yeah. Yeah.
Yeah,
Yeah, exercise is a nice lifestyle choice. It's not going to fix your physiology on this level.
right. And like when I had the gas leak and my score was 55 and I felt terrible, there's no exercise, right? I didn't want to do it. Even if I did, it wasn't going to help. And when I had mold in 2016,
Yeah,
like
the
I went
mold.
online and somebody said, well, if you have, I had anxiety, and he said online, you have to exercise through the anxiety. It's like, no, that's not it. Sorry.
Yeah, yeah,
Yeah.
yeah, yeah, yeah. The mold folks, they can also, I know there's a time when people get out of mold, and there's still some confusion of, what's better, what's not. So this could be a great test to get people to trust their body again too after a mold exposure.
Yeah.
Yeah. And yeah, our Lyme folks. Yeah. Yeah.
Yeah.
This
That's a
is
really good
exciting.
point.
Yeah.
Yeah.
So, well, I'm really grateful for all the work you did. I know this was like a labor of love to figure this out and to bring it to, get somebody to bring it to market and to have this as a clinical tool. So, we're all very grateful for all your hard work. So,
Thank you. I appreciate that.
yeah, of course, team effort, right? But you're
Yeah.
leading the charge here on this. Darren, is there anything else you want to share that's on your heart before we wrap? And please share where people can find out how to work with you or learn from you and all of that great stuff.
So what I want to share is that we need we have a million medical doctors and what 80,000 chiropractors. We have a lot of practitioners in the United States. Everybody should be running MVX. Even if they're a plastic surgeon, they should be running it, to monitor their patient's health as they get better from the surgery, whatever they had. So that's my goal, is to get as many people running it. And the best way um, learn from me is, well, YouTube is my main platform, but I'm setting up trainings, and so you can search me out on the internet. I have my office website. I'm working through another website called Power Nutrition Practice, and I'm having doctor trainings through powernutritionpractice.com. And then I have, for this podcast, I have a link to learn more about MVX. Yeah, click on that link for that.
Awesome. Well, we'll have that available alongside this podcast. And I'm so grateful for your time. And thank you so much for all the great work you're doing in the world.
Welcome. Thank you for having me.
Thank you. Thank you for listening to the Spectrum of Health podcast. I hope you enjoyed this conversation today with Dr. Schmidt. Please check out in the show notes how you can take your own MVX. It's really an awesome tool, and I hope it empowers you on your next step to health. Thank you.